Human papillomavirus, or HPV, is the most common sexually transmitted infection. There are more than 40 types of HPV that can infect the genital areas of males and females, as well as their mouths and throats. Most people who become infected with HPV don't even know they have it and can go years without showing any signs or symptoms. HPV is passed through genital contact, most often during vaginal and anal sex, but also through oral sex and genital-to-genital contact. It doesn't matter gay or straight, HPV doesn't discriminate. It can be passed between opposite and same-sex couples alike. Signs and symptoms of HPV. Most people with HPV do not develop symptoms or health problems. In fact, in almost 90% of the cases, the body's immune system clears HPV within 2 years. Unfortunately, this is not always the case. HPV can cause warts on the hands as well as the genitals, in some cases even the throat. Other types of HPV can lead to abnormal cell growth, sometimes resulting in, most commonly, cervical cancer in women, but also cancers of the vulva, vagina, penis, and anus. It has been estimated that 9,300 cases of male cancer patients and 17,600 of female cancer patients develop their cancers from HPV. These cases account for a very large percentage of the total cancer cases of the 5 types of cancers associated with HPV. If HPV does not clear up by itself, there is currently no treatment for the virus. However, there are treatments for the problems that HPV can cause. There is medication for wart removals caused by HPV. Abnormal cell production will most likely become normal over time. However, if they don't and they're caught early enough, they can be treated to avoid the development of cancer. But if you don't feel like dealing with any of this, there are some very simple ways to reduce your risk of getting HPV. Condoms can help protect against HPV contraction. However, HPV can infect areas that are not covered by a condom, making it not 100% effective. The vaccine Gardasil is much more successful in preventing HPV. This vaccine is safe and effective. It's given in 3 doses over 6 months and most effective if given to a child age 11 or 12. Anyone can get HPV. So I want you to stay smart, stay safe, and get educated.